Hello, my name is Yesenia Reyes, and I will be conducting a thorax, cardiovascular, and lung exam on my volunteer patient. So, to begin the exam with the lungs, we're going to go ahead and look at his respiratory status, look at the overall depth, which is normal, breathing effort, which is also effortless. We're also going to take a look at the overall rhythm, which is regular, and any use of accessory muscles for breathing that would indicate respiratory distress. In the ideal setting, he would be exposed from the thorax so we could see any muscle deformities or any breathing irregularities. But for the sake of privacy, we'll keep his shirt on. But I'll be looking at the intercostal spaces as well as the neck and the scapular region for accessory muscle usage for respiratory distress. Also, just overall general appearance, general color, looking for any cyanosis of the lips, as well as any pallor or anything that would indicate respiratory distress. As far as the accessory muscle usage, I don't see any. And we're going to go ahead and look at his respiratory rate. So we're going to go ahead and calculate that. Okay. And so for overall breathing rate, I did get 16 beats per minute. And again, no distress noted, no irregularities noted with his respirations. I'm also keeping an ear out for any auditory signals like wheezing, stridor, anything that would note respiratory distress. So beginning with the anterior portion of the chest, I'm also going to take a look at overall symmetry. I'm going to take a look at where his sternum is, feeling for any indentations, which I don't feel any. I'll also be looking for any tenderness areas. Any tenderness? Okay. And then as far as the chest itself, I'm also going to be checking for symmetrical expansion with inhalation. So I'm going to go ahead and do this and breathe deep. One more time. Okay. And so expansion was symmetrical. Next, I'm going to be checking for tactile firmness. So go ahead and say 99.
99.
Again.
99.
Again.
99.
Okay. So tactile firmness was expected as normal. And then next, I'll go ahead and start checking for percussion for any hyperresonance or areas of dullness. So we'll check there first. Okay, so no areas of hyperresonance noted. And next, we're going to go ahead and begin with auscultation of the bronchial sounds, bronchiovesicular, and the vesicular sounds, starting with the trachea. Go ahead and breathe out. Take a deep breath. Okay. Okay. Take a deep breath. Okay, so as far as respiratory sounds, I was checking for any adventitious sounds such as crackles, wheezing, any areas of stridor, any other abnormal sounds, but there were none noted. So next we're going to go ahead and go to the back portion of the chest. Okay, so moving on to the posterior portion of the chest, I'm going to be checking the same thing for any areas of tenderness, which I don't feel any. I would look for any areas of bruising as well, any sinus tracts on the back of the chest. And I'm also going to be checking for chest expansion as well from the back. So go ahead and take a deep breath. Okay, so chest expansion was normal. Next, I'm going to also check for palpation for the same thing for any areas of hyperresonance, any areas that are fluid filled. Okay, so no areas with hyperresonance, everything was normally resonant. Next, I'm going to check breath sounds with my cue. Go ahead and take a deep breath. Okay, again. 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 Okay, again. And one more time. Okay, so no adventitious breath sounds heard in the back. Next, we're going to move on to the cardiac portion of our exam. The exam with taking the patient's heart rate and blood pressure. So first I'll start out with the heart rate, checking the radial pulse. Okay, so for the patient's heart rate, I got 84 beats per minute. Next, I'll go ahead and check blood pressure. So we go ahead and slide. Okay. Okay, I'll ensure that the bladder of the cup is towards the brachial area. Okay. Next, I'm going to inflate the cup until I feel the radial pulse disappear. Okay. Okay. Next, we'll go ahead and reinflate. Okay. And for blood pressure reading, I got 128/92. Okay. Okay, next we'll begin by examining the carotids, listening for any bruits. Okay, go ahead and hold your breath. Okay. You can go ahead and breathe normal. No bruits heard in the carotid. Next, we're going to go ahead and palpate for the carotid upstroke. Feel the rhythm of the pulse, as well as feeling the amplitude. Everything is normal. Also, I'm noting if there's any thrill in either carotid, which would indicate any stenosis, which I don't feel any. And then next, we're going to go ahead and have the patient lie down so we can inspect for the heart sounds. For the next portion of the exam, we're going to have the patient lie at about a 45-degree angle. And the first thing we're going to check for is jugular venous pressure. We're going to go ahead and have the patient look to the left side. And we're going to go ahead and take a look here at the neck area to look for any venous distension, which right now none is seen. And to approximately measure venous pressure, we're going to check for the angle of Louis. And go ahead and take a deep breath and bear down while you hold it. So I do see the jugular noted right here. but no significant distension is noted, so it is normal. Next, we're gonna go ahead, you can breathe normal. We're gonna go ahead and look for any precordial movements, any pulsations, which I don't notice any. And then we're gonna go ahead and try to feel for the point of maximal impulse, which I do feel about here. Okay. Next, we're gonna go ahead and listen to the heart sound starting at the point of maximal impulse to check the apical area, starting with the diaphragm of the stethoscope. Okay, so that's listening to the mitral valve. Then we're going to go ahead and go to the Erb's point. And we're going to go ahead and check the pulmonic valve, and then aortic, and tricuspid. While listening for the heart sounds, I'm checking for regular S1 and S2 sounds, as well as any gallop sounds, any clicks. And then we're also going to be checking with the bell of the stethoscope for any abnormal sounds. Okay, go ahead and take a deep, slow breath. Okay. And while doing that, we're checking for any pathologic splitting of the S2 sound, any other adventitious heart sounds as well, but none were noted. Okay, during my exam, if I had felt any thrills with palpation or if I had heard any clicks or murmurs during the auscultation section, that would warrant for any further examinations. But everything as far as examination for the cardiac and thoracic areas were normal for this patient. Thank you.